There's been a lot of talk lately about breast implant safety. In fact, they found a link between certain implants and cancer. Insider Dr. Max Polo answers questions from our viewers and explains the serious symptoms. We have a caller. We have Cindy from Miami. Cindy, good morning. Are you with us?
Hi, good morning.
Good morning.
Thanks for having me on.
Absolutely. You have a question for Dr. Polo?
Yes, I know Dr. Polo very well. He's an excellent surgeon, very nice person. Hi, can you hear me?
Yes, he can.
Good morning, Cindy.
Hi, good morning. How are you?
Great. How are you been?
Oh, very good. Thank you.
Good.
I jumped on a little bit too late, so maybe the question might have been answered already, but I had implants myself. I am a breast cancer survivor, and I developed what everybody is now calling implant illness. I developed scleroderma. I developed Raynaud's, and also some other conditions with blood pressure and thyroid. And, you know, a lot of things people are saying, oh, it could be from your implants. Well, my implants have been removed, and I still have scleroderma, and I still have Raynaud's. So it's kind of confusing, not only for myself, but for others, I'm sure, that are listening. You know, is this really true? There's no clinical studies done on it, but you hear it so many times. Many women are developing these illnesses, and then they don't know really if it's true or not.
Thank you, Cindy. Dr. Polo?
Yeah, Cindy, yeah, that was a topic I think we were going to possibly discuss a little bit later, but it is something that was on, you didn't miss anything on that yet, Cindy, but it is something that the FDA did address in these recent hearings. And breast implant illness is not a specific medical diagnosis that has been described as yet. It's more sort of a group of non-specific symptoms that women with breast implants have described and experienced, and some of them you know, attribute to their breast implants. And it's something that we're looking at you know, more specifically, just like we are with the ALCL. The FDA and the plastic surgery societies and the implant manufacturers have all committed to trying to investigate this more. You know, like with Cindy's case, I mean, scleroderma and these other symptoms and diseases occur with and without breast implants being present. So we do need to, there do seem to be a specific sort of subset of breast implant patients that develop these problems, and when they have their implants removed, their symptoms may improve to some degree. So we're trying to find out if we can identify what patients may be at risk of developing these conditions if they have breast implants and some type of markers. So as of yet, we haven't found anything specifically to describe a syndrome that we can identify, but we're investigating it more and doing what we can to try to, you know, help these patients and try to prevent it if we can.
Thank you, Dr. Polo, and thank you so much, Cindy, for your question. Now, what she's referring to, that's separate from ALCL, correct?
Correct, yeah. Completely separate.
Okay.
Yeah.
Now, how many years after getting implants is someone at risk for ALCL? And let's first start before that with symptoms of ALCL. How does a patient know that they're experiencing symptoms that something may be wrong?
Yeah, most commonly patients present with enlargement or swelling of the breast, and that's due to a collection of fluid around the implant. That's the most common presentation. There can also be a mass or enlarged lymph nodes, hardening of the breast, or pain and discomfort.
As well, and then we see there it's a skin rash. The breast gets hard as well?
Skin rash can occur, but that's more rare. It's most often just enlargement of the breast, and that can cause hardening of the breast as well. There may be an associated capsular contracture.
Okay,
But most patients present with enlargement, noticing that the breasts look different, one side becomes bigger, and there's some asymmetry possibly.
And that would be a red flag. Dr. Polo, we have a caller. We have Kathy from Key West. Kathy, are you with us? Good morning.
Yes, I am.
Hi, you have a question for Dr. Polo?
Hi, good morning.
Good morning.
My question is, I've had these implants for over 40 years now. There's scar tissue, I guess it's scar tissue, which would cause a bacterial defect on it. Is there a way that I can get them softened again? Because they're hard as a rock almost.
Right. Yeah, that's most likely a condition called capsular contracture. If you've had your implants for that amount of time, there's a fairly good chance that they may be leaking. That's not an emergency situation, but they can lead to hardening of the breast and capsular contracture. So I would definitely suggest that you see a plastic surgeon for evaluation and treatment. But the treatment is to remove the implant and the capsule surrounding it, and if you wish, replace another implant or any other procedure that may give you a better outcome.
Thank you so much, Kathy. Appreciate your call. So in that case, a patient would need them removed and replaced if she desired?
Yeah, not necessarily so. I mean, the first thing to do is to investigate the integrity of the implant. So we would do some imaging studies, ultrasound or MRI, and determine whether or not there's any leakage of the implants. She's had her implants for a long time, so most likely there has been. So two separate things, the implant and the condition of the implant, and then the capsule around it, which has sort of thickened and hardened. So the capsule being removed to make the breast soft again is the primary treatment. If there's a problem with the implants, and if she's having that procedure performed where you have to remove the old implant anyways to do the surgery that's necessary, it doesn't make sense to to replace, a 30-year-old implant. At that point, we would, replace a new implant if she wishes.
Okay. Now I want to transition back to ALCL. So at that point, when if a woman presents with these symptoms, what is the next step? Are you doing exams or scans on the patient?
Right. Thorough history and physical to find out what the history of that patient is, how many surgical procedures have they had, what type of implants do they have, at this moment, in the physical exam to, determine exactly what's going on. It may well be a capsular contracture or something that's not at all, a symptom that presents with ALCL. So, investigational studies with imaging of the breast, primarily an ultrasound is what we're doing when we're looking for fluid around the implant, which is the most common presentation, is usually present in this condition. An MRI may be more sensitive at determining implant leakage or give more information.
How treatable is this cancer, Dr. Polo?
Yeah, it's highly treatable. So those are some of the things that are important for patients to recognize. First of all, it's a very rare condition. So from all of the data we've accumulated to date, we've calculated that the incidence in women who have textured implants, again, if you have smooth implants, there's no risk at all from what we know now.
Right.
But with textured implants, the incidence is 1 in 20,000 for all textured implants. So that's a 0.005% of developing this condition, throughout the lifespan.
So let's say that a woman does, the diagnosis shows that it is ALCL. At that point, do the implants need to be removed?
Yes.
They do?
Yes.
Okay.
If this is diagnosed, the primary treatment is removal of the capsule and the implant that is present. And if the patient wishes, another implant can be replaced, or they can have some other procedure, like fat grafting, for example, to help augment the breast.
And like Dr. Polo said, these are the symptoms to watch out for if you have implants. Unexplained breast enlargement, asymmetry, fluid buildup, lump in your breast or armpit, skin rash, hardening of the breast. Now be sure to watch the rest of Dr. Polo's interview on the Health Channel app. You don't want to miss it.